issue regarding PAs earlier, like in October, November, where every medication had to have a PA. And so we were having people go into the emergency rooms because they weren't getting their medications filled in a timely fashion, because we would have to work overtime to get the number of
Asking
things.
for the PAs is illegal because the medication is
Well, and that's what I'm asking about, if it's a different medication or if it's just medications in general, because that was a huge issue with Iowa Total Care in October and
They
November.
made every PA for every medication get redone.
Right, they did a PA for everything for quite a length, probably about a 2-month time period, and we didn't have to go that meds.
Yeah.
So one
So
more
they're not
thing,
following the FDA guidelines at all.
so one more thing before the providers leave, or if you'd like to, I'd love to have you stay if you can, is social determinants of health. And many of you know that this is something that the healthcare world has talked about for 15 years, maybe 20 years. But you don't, you rarely see that insurance companies or medical professionals are able to move this forward in any way where it's universal. So I've been working this summer and this fall with the governor's office, with the MCOs, with IME, to try to get them to recognize that this is an innovative response to some of the systemic things that we're seeing in the exact areas that we're talking about. So whether it's Meals on Wheels and the elderly, whether it's telemedicine or mental health or whatever it is, what's the systemic issue in that regard? Let's say for a child who has mental health issues and they are couch surfing. So what's contributing to the mental health issues or the depression, and maybe they have no home, or they keep getting evicted, or for whatever reason. So how do you then address the housing situation? And in Oregon and some other states, they've started to collect data around housing, food neglect, food deserts, those kinds of things. And United Healthcare and the AMA is now developing Z codes. There are Z codes and billing codes in Medicaid right now, but there are very few of them. And of those billing codes, they're pretty narrow, and they aren't used very often because they won't reimburse them.
Right.
Yeah. And so what we're proposing is the development of the Z codes in a wider fashion, and if we need to start pulling data in a more standardized way. And the MCOs are agreeable about pulling data in a standardized way. So across the board, we have to decide what are we going to focus on that are the really large parts of the effect on mental health, or the effect on maternal health, or what is an effect, the larger things. And maybe there are 5 Z codes around that, or there are 5 Z codes around this, or something around transportation, something around housing. So it gets complex, and it gets kind of like, okay, so how do you describe this? And how do you do the deep work around it, that wraparound work? What does that look like? It's very different than having a Medicaid patient have a gym membership. You all know that's a huge arc there. Okay, you can be a Medicaid patient, you have a gym membership, it doesn't mean you're going to use that.
Exactly.
There's not somebody helping you
If you don't have transportation to get to the gym.
and understand that and help you realize how that's a big part of what your physical health, and it's relating to your mental health. So that's that big leap. So we're going to try to close in on that in some way. It may take a year or two before I actually get this mountain moved, but Leslie, you know how hard this is.
I do.
Oh my God, just to try to get everybody in one room. It took me 6 months to try to get everybody in one room about this. So we're going to look at the SIM grants. So the SIM grants, for those of you who have worked in public health, or you've looked at some things in public health, there were about 23 or 24 SIM grants across the state, and each of them revealed data on different things. And so there's some data out there that gives us a direction on where we should start with this and in what area. But I think all of you know where to start, based on your claims based on anecdotal information, but we need data, right? We can't just go anecdotally. So the collection of data, we begin that and start that in areas where we know we have high frequency of, you know, repeat visits to the doctor, repeat, you know, admissions into the hospital, then maybe we can start to, you know, alleviate that. Oh, Sophie.
So one of the concerns that I've had as a social service agency, community-based organization is, you know, whether it be through the work that we do with IWISH, whether it be through the work that we are doing in terms of Black maternal health, whether it be in terms of the work that we're doing with the Community Schools Coalition. Essentially, we're doing work that the MCOs were brought in to do, and then they're going to end up being rewarded for it. So we've been kind of trying to navigate these conversations with them and saying, hey, how can you fund a pilot or something like that? But in the long run, it really feels like we're begging them to do what they were put here to do, which is work that we're already doing.
And the issue is, between AmeriGroup and Iowa Total Care, there's a difference of experiences with the members. So AmeriGroup has had 4 years of working with their members and then adding on. Iowa Total Care is new to Iowa and the caveats that come with healthcare here. And so Iowa Total Care feels that they're ready to go on this, even though they've only been here for the number of months. But I get what you're saying.
Yeah.
Google North Carolina waiver healthy opportunities.
Okay.
They've written a waiver that is spectacular. And it's,
I have one more thing and then I'll shut up for the minute, I promise.
sure, go ahead.
Okay, so one of the conversations that I've been having in educational settings, I was on the Limerick School Board and I'm part of the Community Schools Coalition on behalf of Verizon. And one of the conversations that I've been having with educators and with counselors at Limerick, there's an entire team of people focused on making sure that the student life is, you know, that they're working toward these social determinants of health. And when I say, raise your hand if you've heard of the social determinants of health, not one of them has the language for it. They don't know that language, and so they don't know that someone else is being reimbursed for the work that they're doing. So I think, I don't know what we can do there to make that known on a larger scale, but I think that it needs to be, because so many educational institutions are working to make sure that the home life of these kids and that the families of these kids are supported in the community, and they're not getting anything back for it, and we're cutting funding to schools.
That's why we're talking about it.
Yes, yes.
So we're on the impetus of this, because many people are not getting reimbursed for that and should be.
Yeah.
In a qualified way.
And it's a combination of Grant Wood 88 and schools putting that money in themselves to take care of that. There are some pilots in Cedar Rapids that are trying to emulate a little bit about what college community has done and what Lamar is doing, just having that wraparound services. And then there are certain buildings within the district that have pockets of it, whether it be ACAP rooms in the high schools, in a couple of the high schools, where you have free clothing for kids, or actually clothing stores where kids can go and shopping for clothes and pick up food once or twice a week to take home to their families. But yeah, that's Grant Wood 88, and see like the schools picking that up and we're on the phone. Yes, we are.
Did you have
I just had a final question, and this deviates from what you were saying, but when you were talking about providers going to other states to practice, I mean, some of it is because of reimbursement, but we do not have a cap on tort reform in Iowa. I mean, we've already paid out $85 million and I understand there's bad cases, but physicians are being sued at a level that is astronomical in closing practices. And so our surrounding states are being capped on some of the personal damages. If we don't start helping what we're doing with our malpractice tort reform, we're going to continue to lose providers and people won't stay in Iowa to practice.
All right, so let's kind of turn the lens here, and for some of you that are here for about members, I'm just going to run through
Real
this
quick,
really
if you
quickly.
didn't sign in, could you sign in so Liz and I know who is here, and I'll get Liz that copy. And if anybody wants my newsletter, also sign up on the other one, please.
So I'm just going to run through this real quickly. Some phone numbers, if you haven't, there we go. So Medicaid member services, if anybody needs the number for that, needs help around that. It's 515-256-4606. When you need to ask questions in terms of, and you'll again, your correspondence says Iowa Health Link, actually, instead of Medicaid, it will be Iowa Health Link. And then their website is, just Google Iowa Health Link and you'll get the website. AmeriGroup's phone number, if you need that, it's 1-800-600-4441, or through the web, you can also email people, myamerigroup.com, Iowa, and Total Care, 1-833-404-1061, and it's iowatotalcare.com, and they also have emails that you can email an info, web address, and they'll, Iowa Medicaid Provider Services. It enrolls providers with Iowa Medicaid and can assist with eligibility questions, MCO questions, and support with Iowa Medicaid coverage. Providers must also contract with MCOs to be reimbursed for the services they provide. This is pretty elementary, most of you know this. But that's a toll-free number you can call, and locally, 515-256-4609. And then the email is IME Provider Services. If you have a quick question, and usually they're pretty responsive, I've used that. As a mystery shopper, I've used that. I occasionally call the MCO just to check. See if they'll take my call. And then, and they do, they take my call. Medicaid Member Services, did we already talk about that? Yep, we did. Okay, I'm going back to it. Okay, AmeriGroup Provider Services and Iowa Total Care Provider Services, you know that. And then here's the Managed Care Ombudsman Program. So again, you could just Google Ombudsman, you can spell it. And it has a number of explanations on there if you have a difficult case and that you need some help with that difficult case, you're not getting anywhere with it. They'll try to help you as much as they can. And then your local legislator. If you go into, again, there's a tab, instead of in the first hour, it's a legislator tab. Just click on that, and then you'll get a screen that looks like this. And then it'll say, find your legislator. You can put your town or your zip code in there, and your legislator will come up. Or if you already know who it is, click on Senate or House, and it'll look like this. Then this is what the Iowa Senate page looks like. So it's alphabetized, or excuse me, it's by number, and you can change it to being alphabetized. And then here's everybody's email. Email is probably the best way to contact your legislator. You may get an auto reply on some legislators' emails that they'll say, session starts on January 13th, but they still do read their emails. They filter out their emails. Some legislators will tell you that they only will respond, or they will respond first to constituents, and then secondly to other people. But I mean, Molly and I get emails from all across the state, especially on Medicaid issues, because other senators or other House members don't respond. They don't answer emails.
It doesn't matter to me where you live. I'm representing all of Iowa.
Yes. We vote. When we vote, we vote on the whole bill that affects every Iowan. So, yeah. But with this issue, you get a lot of emails. A lot of emails. So, some people are offended when I say, and may I ask who your legislator is first? And usually it's, I've already contacted them and they're not responding, and we've got an issue around, a transplant, or around life or death authorizations.
So when you hear that, do you track that legislator down?
Yes.
Thank you.
I CC them in any further correspondence, because they need to know. It's somebody who lives in their area. They need to know that this is going on. Rather than coming back to the Senate or the House, you get up on the floor and you talk about it and they say, I never heard anything. I didn't ever hear anything. Well, that's because I responded to your constituent. So So yeah, I have CC'd, and I also CC the governor's office.
Good.
So, and let them know we're answering from all of this. So, members, you ready to roll? What do you have for us?
I just need these.
Nikki, are you ready? Scott, Scott has something.
I'll start it off.
Yeah, okay.
Yeah, you take care. Take care.
Our son was disabled young, at around age 20. Went into the Medicaid program, was relatively pain-free on that for some years, but then he went to a residential care facility as a serious one. And then he was transferred out of there. So he was actually discharged from, let's say, someplace in Dubuque, and he was going into another region in Clinton, all hypothetical. And so he goes there, and the new place, which is now a group home, so that's a different level of care, never picks him up. So that is, when I say not physically picking him up, I mean paperwork never picking him up. So they never did anything with the discharge to then readmit him to the new place. So this went for about 3 months.
Same agency or different
Different-
agency?
different
Different
agencies.
provider even?
Yeah.
Okay,
So
okay.
different providers, but the system is siloed, so that when he was discharged, if nobody just picked up the phone and called DHS and said, yeah, he's coming here, what the state saw in that was, well, he was discharged, he's now healthy. And but it took several months.
Medicaid.
So they stopped Medicaid at the end of
What?
Yeah.
They threw him off the Medicaid.
Well, no, they waited several months and nobody said we got it. And as a result, they just, at the end, it was kind of like at the end of December it was. And so he was going to see a doctor to get an injection or something.
Antipsychotics,
yeah.
kind of important.
Yeah, and they said, well, he doesn't have Medicaid. He's not covered with Medicaid. And there
And
were,
then you've never done a letter
No.
from them saying?
no, well, that's my next point. But, so.
Because we've gotten plenty of those.
Well, no, it didn't get that. All it was, no, it's not working. Your member ID doesn't work. And so then he was not allowed to get an injection of an antipsychotic, was not allowed to go and get like a flu shot or just, whatever. And so, but the problem there is that they're not handing people off in the electronic system that covers these things. If you fast forward a little bit, just in the last couple of weeks, food stamps, EBT card. He was living in one residential or group home, and they evicted him, even though he was court mandated to be there. So he went to another one in Clinton, and when they did that, he did a change of address and all of that, but nobody in the second group home changed his address in the system. And so as a result, they kept sending you need to do your yearly review and the paperwork for that to the old address. And so at the beginning of this month, EBT card had nothing on it. And so we've now gone 16 days without that. And I received this multi-page review form that I have to then fill out as his payee. But then it'll be processed, and it probably won't be until February that those monies will be there. And it was because they were still sending to a form that has to be filled out to the old address. And so the only place that you can change the address, when I called the food stamps program, I said, well, can you just change this? I'm like, no, you have to do it in your annual review form, the one that we sent to the wrong address. And they said, you have to fill that out now, and that's where we'll make the change. on paper. It cannot be done electronically. Just imagine somebody who has schizophrenia, who has to do all of that paperwork.
It's a nightmare.
How do you not have a system within DHS that links these potential programs from a single database? That's really critical for having some continuity of care and coverage of things. And I think Iowa does a very poor job of keeping track of these patients that really need to be kept track of. But the discharge thing for Medicaid was stunning. And it was because this was Hillcrest Family Services, which at the time, they were overwhelmed, understaffed,
Yes.
under-reimbursed.
Well, they filled out their paperwork though, they discharged them, it was the new agency.
But
that
it was a new
never
agency,
did.
but, so I thought that was the problem. And they said, well, we did get that in about a month late. But it took about 3 months before they realized that, well, he was just discharged, and we're done.
Now, the
Okay.
concern is more about people that no longer have parents or family members to
Yes.
advocate
Yeah.
for them. We're worried about what will happen to them when we're dead.
Did he not have a social worker or like a caseworker?
He does.
Case manager?
He does have a case manager,
Yeah, well,
but they don't help with this stuff.
I contacted the group home, and I said, can you tell me what's going on with this? And they said, well, you were supposed to take care of this.
No.
I said, okay, fine. I said, well, I'll take care of it. Where should I call in the local area to deal with this? Never got back to me. 4 emails over the course of a week, never got back to me. So I finally just went online and started looking for things, and lo and behold, there was an office in Clinton. And I called them, and luckily, I mean, just randomly, a person answered the phone and said, oh, is he still living at this old address? And I said, no. Well, that's where we sent the annual review form. And I said, well, how can that be? And that's when I asked, where do we change the address? Can you change it for me? And she adamantly said, no, we can't change that by you telling me that that's his new address. I can't key that into the system. You have to write it on the form and mail it back to us, and then we'll key it.
Okay, this is ridiculous because 25 years ago, Tucker was injured. And we set up a CDAC account for him. And we had to go through all this interviews, and I mean, it took 3 weeks before they finally got the information they needed for CDAC. Then he transferred to the University of Iowa. And so I called his social worker, and I said, he's moving to the University of Iowa. And she said, well, then I'll close his case, and you'll have to contact Johnson County and open up another account there. It's the same freaking stuff.
Yeah.
that
25
was
years later.
25 years ago.
In 25 years, they haven't figured out how a computer works? I'm mad.
That's the very reason why we haven't moved in 20 years.
But that's the problem is that
Yeah, same
each
with
group has their own archaic
Yes.
computer system, and they don't communicate between the silos.
I remember this conversation so precisely because I felt so bad about it afterwards. Because this social worker was talking to me about how many people she's got to take care of, how much paperwork she has to do. And I said, well, good golly, figure out a way to not have to do so much paperwork. You're causing your own problems. He moved 40 miles.
The other part
I
is,
got
as simple,
of it a couple times, and I had to wait a period of time to get back on. And so it takes, 6 months, a year and a half just to get on the program.
people can,
Medicaid,
And
let
it
alone.
took three weeks, a year and a half ago, to get back on.
I just even by that other, so Hillcrest, didn't they see that letters were coming in for him and contact you
No,
and say, are you his conservators or his guardian?
I'm his payee, so I
Okay.
cut all the checks for everything.
And
But-
so why wouldn't they have contacted you and said, these are
Well,
still
this was a,
coming in?
well, this was a group home. These are, this
Okay.
recent thing with the EBT is
Was the
two group homes. Well, they evicted him because he was vomiting. And so they gave him a 30-day notice on that. And so when he was vomiting because of medications and things. And so that created an ugly scene. And so they were like, you know,
We're
goodbye.
done.
So,
The bottom line is, it's a lack of accountability.
Yes.
Yeah.
Most people,
Yes.
you and I, we
Right.
received that letter, we realized, oh, this is
Sure.
important, we're gonna get it,
We're
we're
gonna
gonna
get
get
it.
it now.
Right.
There's none of that happens for people who are.
No, there's no transparency, there's no nothing
Did
between.
Hillcrest know where he was going?
yes,
Yes.
yes. And Hillcrest did what they needed to do.
They did.
It was-
It was a
But I mean,
different.
It was imagine
just
the
think-
possibilities that when they got him, the same day, I mean, it was a clean handoff. They just never filed the paperwork to say, yeah, he's now starting in here. Now, one might ask the question, why wouldn't you do that?
Yeah.
Because you would get reimbursed for
Sure,
some of that
yeah,
period.
that's exactly right.
But it took from September until December for that to go through the system. So that also is a problem in that it took that long for the system to go, okay, we're pulling the plug on this.
Well, the other thing is, even if he'd gone home, would he still need his Medicaid?
Yes.
Yes.
Right.
It doesn't matter where he
Yeah.
is, he's still needs
In the
the
Medicaid system, people said, this is a huge problem. But their system never checked to find out where he was.
He's still alive.
They just took him off the rolls because he had been discharged at a place and never readmitted. This is a real problem.
But why would they discontinue Medicaid, even though he might need Medicaid?
Well, this was the.
Even
the-
after discharge?
This is the rub. He was disabled and eligible for Medicaid, but the thing that triggered it was the discharge. And then no one picking him up. Now, you might ask, what difference does that make?
Well, yeah.
I asked that question, and they basically said, yeah, that's a problem. And I'm not exaggerating this. I mean, and to get to the right person to talk about
Yeah.
why he had been, this had happened, literally took a week of phone calls every day. And finally, somebody said, you need to talk to somebody in Sioux City. So I called up to Sioux
Yes.
City, and that person said, oh, well, yeah, you do this and you do this. And she kind of had some insight, well, that was wrong. And so, and so I chased that one for a while.
So she sounded like she had some.
Well, she was very helpful, yeah, but just not the right information. But then I finally got somebody in Clinton where apparently there's an office there. But try to navigate that on the websites. And, you know,
You shouldn't have to deal with any of that.
and I called the right places. And I said, here's my problem. Can you help me? Why is he off Medicaid now? It literally took 8 phone calls to get to somebody.
And the Sioux City person actually helped you then?
No.
Would you, no?
No,
So the
She
person who
had-
helped you was the person in Clinton?
yeah, but that call got me to a series of other numbers to call. But that's how hard it was for me with a PhD to get a simple solution on something. It just blew me away. And meanwhile, he wasn't getting any services.
Yeah.
So how did he?
So where was he? He was in Clinton though, he was still in the group home.
He was still
So
in the
they
group
didn't,
home.
He was in
and
a
then,
different,
then he was removed from there. So
Yeah.
now where is he now?
in another home over there with rent,
Okay.
which is better than imagining possibilities.
And then they are caring for him and giving him services, and are they billing Medicaid for those
As
services?
far as we
Or how
know,
are they
Presumably.
doing?
presumably so.
We don't see that's
We
the other
don't find
thing.
out until there's a problem.
When you,
Well, Liz, one thing that I notice is that they are very assumptive, and they will kick you off if there's any chance that they think that there might be an issue. For example, when you're on MEPD, Medicaid for Employed People with Disabilities, you have a premium that you have to pay. It says on your thing that it's due on the 15th of the next month,
Right.
but if you don't have it paid by the 1st, your case manager will call you and say, we don't show that you're in the system. And it's like, well, it's because I'm having financial problems. We're trying to pay a month's premium. You know, they're just really assumptive. And I would expect that, like in your case, the reason that they might have done that to you is because if you're institutionalized, like if you have an ER admission and then you're in the hospital for more than 30 days, you lose your Medicaid, right? So who's going to call them and say, hey, this person doesn't, they've been in our facility for 45 days? They don't. So
MHIs do, on admission, they call and cancel everything the day you go into the MHI.
But they're very assumptive. If there's any question that you might not qualify, it's like we cancel you, and then we'll figure it out after the fact. It's very much that way. We've shown as like not in the system a couple times, and I'm just like, oh, whatever.
Did they
We'll figure it out. They'll get our check.
Fred, did they cancel then?
It technically doesn't. I think if it goes like a certain amount of time, then it would be technically canceled. I mean, they can't cancel her because they say it's due on the 15th, right?
Yes.
We get it by the 15th, but the case manager calls and says, and part of that's because, you know, case management uses.
You and all that.
Well, no, part of that is that the system that case management at the state and county levels used is called ISIS. And then each MCO has a completely different system.
Yes.
And then they do batch updates. There is no such thing in this system as real-time data, transmission and updates. It's all batch processing. And some of these files don't get transferred any more than maybe once a week. So, the case manager's checking in for an entire week because I sent the check a week ago. And you should be eligible. I mean, you should see her as in the system and eligible. You'll call DHS and they'll say, she's eligible, we received the check, it's all good. But the case management at the MCO can't see.
They just create so much more.
Yeah. So they're just very assumptive. And it's rather than having somebody proactively reach out to the member and say, where are you located? Did you move? Did you have a change of address? Did you not make your payment? I mean, is there something that's changed with your situation? We're really concerned because we can't track this. It's just automatic cancellation or like they'll take you out of the system and it will show, I don't know if you're technically canceled, but it will show as if you're not active to the MCO.
About 30% of our patients show up as inactive at the beginning of every month. At the beginning of every month, about 30% of our Medicaid patients show up as inactive. And then we have to wait 2 or 3 days for them to show up again.
But with MEPD, Tucker tried to be
As
proactive.
a former state employee, I can shed some light on that. The Medicaid program only updates every 30 days. So if on the cutoff, the month before is 5 days before the end of the month to run that batch program. So we receive information after the cutoff date. Then we have to wait for a special run on the 5th day of the next month. But can I encourage you all, if you have a problem, use the ombudsman's office. Because state employees underworked, overworked, underpaid, budget nightmares. That ombudsman will help that state employee wade through that problem to solve it for you. Because that state employee may not have the authorization to do that. But if that ombudsman calls the manager or supervisor, they're going to pay attention and that employee is going to get help to solve your problem. So use the ombudsman office. They are wonderful. They help not only the caller, but they help the state employee as well.
What kind of a computer system are we using
Oh, it's
Or do we have
it's
cards,
Android
are we
and
putting
DHS.
cards stacked in?
It's like a mainframe, like with the green letters on the screen,
Yeah.
and it's
So
really,
maybe that's something that needs to be
Yeah,
built into the
oh,
budget.
definitely.
yeah.
So
It's called
Kelly,
access.
Kelly Garcia has already talked about that with us, is that that's one of the things that she would like to see change. She's the new DHS director.
Oh, good.
And it's one of the things, whether she's gonna get the money to do it or not, you know, it's up to legislators. Some legislators are not fond of DHS or Medicaid. And those are the people that you need to talk to, that you need to let them know that this is important to your loved ones.
Well, I think maybe perhaps you can sell them on the idea that it would save the state a lot of money by having, because there's automation involved. So like when Janelle was the case manager, my wife, she's on Medicaid, when she was the case manager, she was just piled in paper, like always writing annual reviews, and you'd have to have a ticker file, like kind of a Rolodex to tell you who needs annuals, who needs monthlies, who needs quarterlies, and they did it all by paper. As soon as the MCOs came in, the one thing they are doing right is they do like in the field of automation. So people don't come back to the office to write their reports and do their notes. They sit in a coffee shop, they sit in their house, they sit in their car, they're on the tablet with a Wi-Fi connection to the cell phone tower. Yes, they're using, you know, they're using RSA stuff, so it's, you know, smart cards. So it is secure, but they're doing this, and they're able to handle, I mean, whereas a case manager with the county before could only handle maybe 30, 35 clients, it is possible to handle 50, 60. Now, there's no excuse why they have 100 a piece right now.
You got it.
But you could handle,
You got it.
you could handle 50 or 60 with the increased productivity.
Still, that's so high.
But you could handle more because you had the automation, you had the tools. You're entering your case notes in the car as opposed to going back to the office and spending an entire day doing your case notes for the week. So it's one big thing I always told Janelle when I saw her come home and I saw how she worked, and she was just, you know, just falling apart sometimes with all this paperwork. And I'm thinking, why don't they have this automated? Why is it that you have to take a form and write the client's name on it, and write their address, write their phone number, when you should be able to pull up a document in the system where all that stuff is pre-populated? But they didn't have that when the counties were doing it. And it's one of the reasons that case management costs so much, is it was antiquated. There's a sales pitch that you can make to the legislatures that in so many ways this will save a ton of money. I can't figure out why we don't have a way to log in where a client can log into a computer system and see eligibility, you know, yes. With a little green thing that says, or red, please call immediately. I don't get it, and where you can track it to see if somebody's checked on their online account. That's the world that we're in today. Everybody does business that way. There are clients that are gonna fall through the cracks on that, and they need the case management, but like in your case, where in the heck was the case manager?
Exactly.
Well,
He didn't really have one at that point in time.
yeah.
But why didn't he have one? Or she?
That's a really good question.
There's no excuse for that.
Well, at the time when he was evicted, I just called Jerry Foxoven's office and said, WTF, please help, and got his secretary at the time.
Jennifer Steenblock?
Who, yeah,
And that was
fantastic.
helpful.
And boy, did things happen when I contacted the director of DHS. And then he was right to the top of the pile. And we've got a special case manager and a new case manager, and everybody was just hopping to it. But that was when he was being evicted. They still evicted him, even though he was under court order to be there. They decided that they didn't want to have that hassle. And then he had 30 days to actually find a place to live, and that's where the IHH worker
Did help.
But that was only in placing somebody. With the other kind of logistics and stuff,
So the system wasn't gonna place him, they were just gonna release him.
He had been discharged, and that was the thing that I got back from Medicaid and whoever this office was, yes, that was why this happened, but at the same time, they said that should never have happened because he was disabled, and we wouldn't just cut his Medicaid. But the thing that triggered it was the discharge and then no admission following it.
Did they think he died?
No, no, they thought that he had been cured.
Yeah, that's what I thought. That's
How
what
does that happen overnight?
He was discharged.
That would have been great.
Yeah.
And why they didn't know he was discharged? Why did they didn't discharge?
Oh, no, it was a
But
transfer.
Hillcrest.
No, there was a
Certainly
transfer.
Hillcrest.
It was
There
a
was a transfer,
They were-
but why did they transfer?
Well, they transferred.
Why couldn't
We don't
they
want to
stay there?
conflate the two things. They discharged him from a residential care facility to a group home.
Okay,
He had been there for a while. He was doing better. And
So he was ready for.
that's a good
more
thing. So
integrated
it's stepping
service.
down in
Okay.
the type of service.
all right.
But in order for them to do their paperwork, they have to do a discharge. But the other, and what I found out was that the other company, this Imagine the Possibilities, all they had to do was make a phone call to somebody and say, we got it.
I think they dropped the ball. I think that's the biggest thing there.
They did, yeah.
You should be doing the intake paperwork like the minute the person's coming in the door,
Absolutely.
not a month afterwards.
Well, what was funny was that I met with a person, and I said, is everything taken care of? Have you got all the paperwork? And I did my due diligence, and I
I
was there.
think you did the work for them.
I did, but the problem was that they never just picked up the phone. Now, there again is another problem, is why do you have to pick up a phone to do this? Why can't you just go online and say, we picked him up, check?
Yeah.
Yeah.
That's-
Or how about Medicaid reaching out to the client and saying, we're
See
sorry,
the
what's
rate.
going on? We haven't gotten billing from the place he was at. Is he dead? Has he been in the hospital? You know, there is no such thing as like, you know, reaching out and proactively,
There was
you
no
know,
accountability.
resolving or rectifying or.
That's the system.
Do you have a book full of, do you look, what other things too? Oh, hi, Robin. Yes.
Yeah, I'm very new to this. So I hear all of the horror stories here, and I remember reading at a certain point that the state had administered these programs and had done so less expensively than these organizations were doing, and I wonder if the service was better under those auspices than it is now. Has anyone been in the program long enough to be able to compare?
My number one point was I'm so thankful for the health and disability waiver. It used to be called the ill and handicap waiver. My daughter was born, she's 15-year-old, she's almost 16 years old now. But she wasn't supposed to survive, and when she did, it was only because of the waiver. And I flat out guarantee that if I would have left her in the hospital any longer, it would have done her in, just because it was not a very caring environment at that time. And so,
Robin, do you know what a waiver is when she's talking about a waiver?
do you know what a waiver is? It's legislatively, it waives my right to have my daughter institutionalized, so I can keep her in my home and in my care, and the state supports her level of need so that she can live in my home with me.
And usually those on waivers are high needs. So there are 7 waivers in the state.
There's 7.
Mental health, ID, HIV, elderly waiver, the list goes on.
Brain injury.
And you can apply for it. Sometimes there are waiting lists to get on. So we have been successful with building slots, so there are more waiver opportunities for like autistic children to get on a waiver, to get the help they need, because it'll be expensive over the lifetime of that individual. Their issues are not going away. They will be lifelong issues, therefore they can apply for the waiver and receive it no matter what the level of income of their parents. Because, and so that they can receive health care when they need it, and it keeps them healthy and functioning. So
Go ahead.
After the person is deceased, I had that waiver for my sister, and after she was deceased, what she had spent in that, they came after me for. I brought you that.
Really?
Yes.
Oh, wow.
That's
the
sister
That's
has
it,
an
yes,
asset,
yes.
and they came after the
Yes.
asset.
So you were living in your sister's
That's
house?
before
No,
we
no,
were-
no,
yes.
I had my own home, but I was over there taking care of my sister. And we got the elderly, well, the waiver to help us, people coming in doing different things. So after she passed, then they came after me for it, because I kind
See,
of.
yeah, yeah.
And how did you save her from having?
Well, that's another story, but will you continue?
So one of, the system has changed a little bit, but a lot of things have remained the same. But because of the waiver, I had been fired from 7 jobs because I couldn't work full-time to take care of her. And that was just in the first 18 months without the waiver. So once she got on the waiver, I was able to finish graduate school. I had a PhD, graduated, started my own company, and now I supervise a clinical practice that has 5 offices. And we're still kind of hanging on with the waiver, and she's doing great in the home for the most part. She still has a high level of care, and she's still very medically fragile. But just a few things, so as grateful as I am, and I'm so appreciative, there's still a few things that I think need some examination. We had a recent change of case management. We went from DHS case manager to another DHS case manager. The first one lied to me the entire time she had Grace on her caseload about Grace wasn't eligible for CDAC when she was, and she wasn't eligible for rehabilitation services when she was.
Did she just not know that? Was she
No,
new?
apparently she knew, but this was like a common thing that she would have done, is deny services for families. There was a little bit of a joke among parents that like, oh, is she getting a kickback from all the denials, or what's going on with that? So I don't know if that was like so person specific or office specific or what that was, but my new case manager's like, yeah, she could have had this when she was 7.
And this was a DHS case manager, not an MCO case
Right,
manager.
that was a DHS case
That's
manager.
there.
Yeah, and now the new case manager's like, no, it's always been that way.
Yeah.
So,
Yeah.
so I'm a little concerned about that. Like, is that still going on? Is that not going on? I don't know. I don't hear as much about it now because I'm so busy with my eyes focused where they need to be. The other thing was that I'm concerned about a little bit of the nursing care. She's qualified and eligible and needs nursing care. And we live in a rural community, we live in Benton County, and there is no providers, 0 providers. And in fact, the one provider who was willing to come out ultimately said no, because there was no process in place with their company anymore to bill for children, so they closed all children's services. So she can't even get her G-tube feedings, like the supplies for that. I have to go pick those up now, they won't even deliver them. And so it's not a big deal, but for some families I could see it would be a big deal. But you know, and sort of flash forward to today, like this month, I'm in the middle of making a decision about, I've had to close my own personal practice. I can't practice anymore because she needs someone home with her 24/7. She can't be unsupervised. She has a very high risk of going into a crisis just without notice. And so we're at a point now where like I'm not getting fired from my job, but now I'm forced to choose because I don't have another qualified person, even though she has CDAC, but there's no providers. Like we went from the ARC as a provider because they couldn't find anyone, so I went to CDAC. I've been trying to hire someone and I can't find anyone. And so I don't have anyone.
Where do you look for someone? Do you
Yeah.
advertise, I mean, how do you find a CDAC provider?
I'd like someone to tell me that.
Oh,
I advertise, I posted.
Yeah, I can give some advice on that too.
Yeah.
Is there clearinghouse or other?
I have.
Okay.
I've even advertised, like I found out they only have to be 16, so I've been trying to find
yeah, it's
a high
amazing.
school
It's
student,
amazing
and
to
I
do
still
high school.
can't find anyone. In my community, no one wants to do it.
So one thing that you can do is you can go to like a local college We've had success going to Mount Mercy here locally or Co, asking for nursing students, physical therapy students.
Yes.
You can post on newspapers, you can post on bulletin boards. When you think about any just brick and mortar, just simple, like traditional method that you would use to find people, ask family, ask friends, you know, ask, you know, post at the local high school.
How about your church? Do you like
Churches.
Done all of that. The problem is nobody wants to drive out there because they won't reimburse the mileage.
So are you doing
So,
traditional?
and they can't bill that time for driving because it's not face-to-face time. So that's time that either I have to pay the mileage for them to drive out, which if I'm not working, I can afford that.
Yeah.
So I don't know how to balance that out other than I closed my practice. I've already done that. I closed my practice. I'm not practicing anymore. So in my perspective, it's like that, what a shame, all my years of experience, my education, you know, all the things that I worked so hard
I'm in the same
to
boat as you.
do, I can't do it because there's no other providers out there that are qualified enough to handle her unique set of.
Or even if there is providers, you have to spend so much time managing that whole thing because Medicaid doesn't do continuity of care and like management of, you know, providers, you know, continuity of like daily, you know, providers coming in. So it's a full-time job. Like my wife is somebody who has almost 23 hours a day of STL, and it's a 6-8 hour day job managing and checking up on people and making sure that everybody's doing what they need to do.
So one suggestion that I would have.
Yes.
Ooh, good.
Good idea.
I would really
Just
like,
like that.
I would really like the state to reconsider paying parents to care for their minor children.
Yes.
They won't allow it under these rules.
And
They'll
that's
allow
spouses
it
do
as soon
that.
as she turns 18, if she turns 18, they'll allow it then. But for minor children, they don't allow it. I have to hire other people that have no idea how to take care of her.
Okay,
And then I have to
like-
stay there anyway because they don't know what to do if she stops breathing or what happens to her heart or, you know, those kinds of things. And so I have to stay in the house anyway, so what's the point?
And what is what they do in most other states that have the CCO-like program, like with Iris in, I think, Wisconsin or Michigan, Minnesota's program does this, they actually do pay spouses, and they pay parents of minor children. And they need to see that there's a difference between typical daycare,
Yes.
of like, you know, this, you can't send your kid to daycare where it's $2 an hour.
There's no alternative.
You have to, somebody's gotta be there for
She got
them.
to down.
You can't write it here.
Yeah.
Do I need?
Yeah, they gotta see that there's a difference between those two types of work. There's a lot more resources, and because a parent needs that support doesn't mean a parent's trying to get out of being a parent. A parent's gotta be able to work, you know. Exactly. At DHS, I can tell you, doesn't get that. We've had that conversation.
Well, I got Tucker's waiver in. I mean, I got that passed so quickly after he came home from rehab because my insurance covered 40 nursing visits. And I remember so precisely the day I came home from school on the day of the 40th visit, and the nurse said, I need a check for $604 so that I can send somebody for next week. And I had just been paid, and my check was $2,400, which meant that if every week I had to pay $600 for nursing care, it would eat my whole check. So I called the case manager and I said, here's the deal. I just got paid, I have $2,400. I said, I just got told that I just wrote a check for $600 to the healthcare agency. I said, so here's what's gonna happen, is that if he doesn't get this waiver, so that he is on Medicaid, so that I don't have to pay for this, I'm gonna quit my job, and my son, and his sister, and his brother, and I are all going to go on public rules. That's what's gonna happen. Within a week.
What did you tell them again?
She said, if you don't help us, we're all gonna, everybody
We're all
in the family
gonna
will
Medicaid.
end up on Medicaid, rather than just Tucker on a waiver.
And that's
Yeah.
basically what my mother did 6 years ago. She actually had to resign
They're
from
just
her
so
job,
short-sighted.
and she had to make that difficult decision
Well, and
to stay
I'm
home
looking
with me 24/7.
if,
And it sucks.
if Tucker,
And that's why
if
she's
Tucker's
not
able
here.
to keep getting
Because
his
she
care.
gets so upset, she gets so angry, and nothing is done.
Well, there's something to be said for a parent-child relationship. I mean, that is the kick. This is what Tucker learned at rehab. They told him, your family needs to be your family, not your caretakers.
Yeah.
And he has worked so hard to make sure that that is what he's done.
I mean, get this, if you're a parent of a minor child, or you're a spouse of somebody, you can get usually your kid on Medicaid, you can get the disabled person, either the spouse or your child, on Medicaid, but you're an able-bodied adult as the caregiver, so you can't get on Medicaid,
Right.
because they'll use the household income of the whole group
Yeah.
against you and being able to get on Medicaid, even though the son or daughter, the disabled person, the spouse, they'll be able to get on Medicaid. But it's the caregiver that ends up not having any health care coverage.
And
So like in my situation, I hadn't had health care coverage for over 4 years because it was like $300 a month through the ACA. And it was like a $6,000 deductible. And it's like, I can't afford that. I mean, I just throw my money to the wind if I sign up for that. So, you know, they need to start thinking about things like that, like on MEPD. If you were fortunate enough to have long-term disability, your income is gonna, for the household, is gonna be above what the income requirement is for the MEPD program. And they treat earned income one way and they treat unearned income another way. So your earned income from your long-term disability and your Social Security are gonna be higher than the eligibility criteria. But somebody who didn't have any income can go out and make twice as much as what the eligibility criteria is, because if it's unearned, if it's earned income, they'll let you take 50% of that off and then they'll use the 50%. Yeah, so for, say for example, a family of 3, it's $4,400 a month. You could be at like $3,800, $3,900 and that other person could go make like $500 and it'll be over the limit. If they didn't have long-term disability or Social Security, they could go out and make $8,800 a month, which would be a comfortable amount to live on for most families, and it wouldn't affect them. But because they have unearned income, because they have Social Security, if they're lucky enough to have Social Security, the long-term disability, a lot of times, it takes them up to almost the limitation. I'll be doing a video on that here shortly. I'll educate you a little bit more on that.
Master video.
But,
Yeah.
no, I'm not. But I mean, these are the problems that are, you know, you want to encourage people to work, so you're thinking, oh, it's a good thing to have unearned versus earned income. But what you end up doing is, like Janelle worked for the county, she had long-term disability. The county invested so she could have long-term disability. When in the end, having that long-term disability makes it impossible for us to go out and earn additional income, because if we earn more, it's gonna be counted against us. Whereas we could make a lot more if we could make up to the full amount, but only be, it's kind of irrelevant to this conversation, but there's little things when it comes to a parent of a minor child and a spouse that it kind of affects us in the same ways. For sure.
So, it is 10 after 7, and we said we would go till 7, but we started a little late. This has been all good information.
Liz,
What we really, Garrett, we had to pick up where we left off with you.
no, we have one new person,
Yes?
and I just want her to, please just introduce yourself. Just introduce yourself. Whatever.
I recognize your photo. Are you on that MCO watch call?
Yes, yeah.
I know your photo. I don't know
recognize
who you are.
also. Yeah, I'm on it. My name's Candace Honeycutt. We're
Okay.
here from Grinnell.
Yeah.
Wow. Because my current representatives don't really listen.
Yeah.
You do
Yeah, I'm on the health and disability waiver.
Currently, things are okay, but I've had a lot of fights about the home modification. My disease progresses, so things change. And when they change, it's very difficult to wait a year for an approval for a shower bar. You know, so that's where most of my problems have been.
I've heard that too from many people about conditions. There are changes. And
They try to
system
see
allows
that
us
was you. Okay.
to respond to that.
Well, like Tucker, if you don't mind me talking about Tucker, Tucker's been looking at getting a repair done on his ramp on his vehicle.
Oh, God, yes.
And because it's a repair, there was a question, what was the question? It had to do with, you couldn't, the code says, it says in the Iowa code that home and vehicle modification is not it's not going to pay for the repair of a vehicle. So Tucker needed a repair done on his ramp, on his vehicle. So they had to go through this whole process of doing an exception policy so that he could get approved to do the repair on his ramp that's attached to his vehicle. Because it might be construed,
Put on a new muffler, it's fixed, I did that.
yeah, because it might be construed as fixing the car. Even though the repair of this ramp is obviously gonna cost him way less than if he said, you know what, screw that. I'm not gonna go through that trouble. I'm just gonna go order a new one. And then he wouldn't have had to go through that process. So, I mean, Tucker's stuck with it. I think he's in the process of getting approved for the repair. So he's doing the prudent thing, the financially, the fiscally responsible thing. But I mean, those are just the ridiculous things, like working with the MCO. It's like, oh, well, this might be construed as a repair of the vehicle.
So ultimately, he could have gone and bought a door and they'd have paid it back for it?
Well, he wouldn't have had to have so much of an approval because it wouldn't have been a repair on the vehicle. It would have been placement of a new ramp. But it's like,
And that
well,
costs
for
twice as much, I'm sure.
yeah, it's just,
It's only $900.
But if you bought it,
you know, what, 5,000-10,000?
I do one, 7,500 to
for a new ramp?
15,000, yeah.
I mean, Tucker's talking like $900 versus like $7,500. And they
Or more
struggle
for a new
him
one.
along, like a several
Oh,
month
yeah,
process of getting
because
them.
I took it and got the estimate in June. June,
Yeah.
6 months.
I have a left right now, it's.
It's just like,
Luckily, it hasn't fallen off yet. It's ready to rust through. The guy says, you'll be okay for a while.
Yeah,
it's just like,
laugh, right? I mean,
we make it work.
it's just like saying, we're not gonna pay an extra $5 an hour for somebody to get CDAC services through the CCO program. When we know the consequence of maybe not doing that is that you would have an admission into the nursing home, and then it might be 10 times more, but at the end of the day, we know that the person's gonna do everything humanly possible to stay out of the nursing home.
And they take advantage.
So if we call their bluff, we can just, you know, we'll tell them we're not gonna pay for it, they'll find some way to live and breathe. But, you know, should there be anybody in the state out there working for $10 an hour, I think you should go to the Minnesota governor and ask him,
Tim Walls.
because he spent a day doing it, and he knows that that job's worth a heck of a lot more than $10 an hour. And
Perhaps we could talk our governor into
Spending a day doing that?
Well, okay, so, and I'm not defending her, but someone brought up, after Future Ready Iowa was established, someone said, you have completely eliminated, or you haven't recognized the healthcare workforce. You know, and she put Beth Townsend on it.
Oh, good.
And now it's being considered, and the whole conversation around reimbursement rate is now part of the Iowa workforce development conversation. So let's, hey, listen, I've seen things progress and then fall right off the cliff. So I am not gonna get excited until she signs.
Do not count your eggs before
Spending
they
a
hatch.
day, spending a day with somebody who does that might make her wanna help it move faster.
But I tell you, Shelley Chandler is pretty good with the Iowa Providers Association, and she has been able to move some things along in regard to some of the waiver programs and did get the attention of.
Last question, I can talk to you later. I just have one last question.
Oh, sure.
Why can't we get that woman or any of her people to come to one of our meetings?
And have you invited her? Obviously you have.
Yeah.
Have you invited her?
Personally, I don't know if I want to yet.
Well, you can, if you have a comment,
Have
invite
you ever heard the saying, keep your enemies close?
Yes, yes.
I've
Your
offered to
friends
meet with her,
close and your
but she
enemies
won't.
closer.
No, she doesn't return.
Well,
You've gotta
I've
work
written
with people.
emails, but
You
there's
can't
no
just say,
response.
I'm not gonna work with them. You gotta work with people, right? So. I would give him.
Tell Tucker his hair was exceptionally good.
Did you get to see him there?
I saw the picture on Yes, that hair is, you were in Cedar Falls. Actually, there were 2 years ago.
I saw the picture. Cute shit. Yeah. She's kind of old now, so, man. Let's talk offline.
That's what.
They have